Welcome back. And we are going to still stay with healthcare, but away from COVID-19 now, we're looking at diabetes mellitus. A number of Nigerians are afflicted by this, and the cost and implications is huge. Today, the cost and the consequence we're looking at is the connection between diabetes and mental health illness. With us is Dr. Egegbara Ihunanya. It's a pleasure to have you, Dr. Egegbara Ihunanya, here this morning.
Here once more.
Excellent. She's a consultant psychiatrist, and we've talked about diabetes and different things, but I cannot remember if we've really dealt with this and mental health. And it's such a huge discussion, because I'm sure that the correlation is massive. If you do a regression analysis, you probably will see some things more than we can see, especially since you're a mental health expert. So help us understand first and foremost the relationship between diabetes and mental health.
All right. Diabetes mellitus is a physical illness.
Yes.
In the sense that, it affects a tissue in the body. And you carry out certain tests and then you can make the diagnosis. Okay. And on the other hand, mental health is about disease of the mind. In spite of that difference, there is a link between the two, because the body and the mind work synergistically to optimize functioning on a day-to-day basis. So when the physical body is ill, it could affect the functioning of the mind. And when the mind is ill, it could affect the health of the body physically. All right, but let's understand what diabetes mellitus is first of all right, because everybody may not know what the disease is about. So according to World Health Organization, diabetes mellitus is a chronic medical disorder that is characterized by persistent high levels of glucose in the blood. So after one has eaten, food is digested, then the hormone called insulin is supposed to help, the breakdown of that food, which is glucose, find its way into the cells. But in the presence of diabetes mellitus, the glucose remains in the blood. It doesn't get into the cells where it is needed to, provide energy for the normal functioning of different organs of the body. So there are two types of diabetes mellitus. There is the type 1 that starts very early in childhood. It could also be called juvenile diabetes mellitus. So in this particular case, the level of insulin, there's little or no insulin in the body. All right, so individuals usually have to have injectable insulin to be able to, have the glucose properly metabolized. Then there's also the adult onset one, which is a type 2. So at some point, some people's body just become resistant to the insulin their body is producing, or the insulin the body is producing is no longer sufficient for the body's needs. So that leads to high levels of glucose in the blood, all right? Sometimes the manifestation of the illness may not be obvious. It may be asymptomatic, but in some individuals, some of the common presentations could be, excessive thirst. You find yourself drinking a whole lot of water. And because you're taking a lot of water, you want to go and urinate frequently. So the volume of urine is a lot, and the frequency is also a lot. You're waking up more frequently in the night to use the toilet, or even in the course of the day. And then you're eating a lot, yet the person is losing weight. So unexplained weight loss is one of the reasons to also investigate further to see whether there's problems with the glucose metabolism. So that's for diabetes. Then for mental health, the definition by World Health Organization as well is that it's a state of well-being where an individual, first of all, is able to recognize his or her own potentials or abilities. Is able to cope with normal stresses of life, because there will always be day-to-day stresses. And then one is also able to work productively and make positive contributions to one's environment. So from that definition, mental health is not necessarily the absence of a mental illness. So if one is not able to identify one's abilities and capabilities, one is not able to cope with normal stresses of life, and productively contribute to one's community, then the person is also not having optimal mental health. Yeah, so
that's very scary, Dr. Gibara. And I mean, for diabetes, as I'm sure since we're very young and we're taught about health science, you were taught about some basic kind of diseases that could abound then, and then you were like, okay, you knew malaria, you could come to terms with yellow fever, diabetes, mellitus, there are different types. But what kind of mental illness is definitely associated with diabetes, mellitus?
the connection, could come in two different ways.
Okay.
First of all, let me point out that the diabetes mellitus and a mental illness can actually coexist in an individual without one having led to the other. All right? So, but on one hand, the development of diabetes mellitus over time can cause an individual to develop a mental health illness, especially if the blood sugar is not properly controlled. Then some mental health disorders also increases the risk of developing diabetes mellitus. So I'll explain how this works. Just receiving the diagnosis of having diabetes in itself could trigger anxiety and depression.
Yeah.
Because it's not a disorder where, it's not like malaria, you take medication for a few days and then you're up and about again. It's a chronic medical condition. It requires altering your lifestyle. It requires lifetime management, which a lot of people are not ready for at the time they may get the diagnosis. So you need to start eating right. You need to start using medications regularly on a daily basis most of the time. You need to keep to your doctor's appointment. You need to stop some use of psychoactive substances like alcohol and the rest. So the news of the diagnosis itself could be overwhelming for some individuals, and it could actually lead them at that point to develop a mental health illness, typically anxiety disorder or depression. That's one. Then the nature of the illness, diabetes mellitus in itself, I've explained that, the blood sugar level is higher than what it should be because the glucose is in the blood and is not being utilized by the cells. So, but in spite of how careful an individual may be, sometimes there are fluctuations in the level of the blood sugar. It could go too low, it could go too high, all right, in spite of compliance with all the necessary regime. So these fluctuations in blood sugar can also affect mood, cause mood changes, cause fatigue, and all of those things. Then there's what is called diabetes distress, and that is in individuals who, just the worrying about whether would the blood sugar go too low, because that has its own complications and all of that. So, all that worrying causes frustrations, and that symptoms are akin to depression and anxiety. So it can trigger that. It's also a mental health disorder in individuals. And we know that the brain is one of the organs that are quite sensitive to lack of glucose. So when there's a lot of glucose in the blood, it's not getting into the cells. The brain is not able to function accurately. So the neurons begin to malfunction. And when that happens, there could be development of mental health disorders as well, So in persons who have diabetes mellitus, it's been documented that they are 2 to 3 times at higher risk of developing a mental health disorder than those without diabetes mellitus.
Which is also the beauty of, there are millions of people who are living, who have diabetes, either type 1 or type 2, or we even know them, or we may even have diabetes, but still going on with life because it's not a death sentence.
It is not.
To 90s and even 100, because as long as you can control the blood sugar.
Very
Fine.
important.
What should people around? There are people who are learning this for the first time. There are people who live with people who have diabetes. There are people who are diabetic also too, who go on with their life, need to know how to help people during this period when the mood swings happens, or even people with diabetes who are, for example, just realizing now that, good grief, I must have been having this mental health issue for some time, not knowing it was linked to the diabetes.
Yes, because actually that's a very important point. It is usually missed a lot in persons. The mental health issues are usually missed a lot in persons who have diabetes mellitus. So, I mean, being aware of the common symptoms, like common symptoms of depression, the person, you know, suddenly just having lack of energy, lots of interest in things, they're not even interested in using the medication. You talk about the doctor's appointment, they're not concerned anymore. You know, the things that they normally enjoy doing, they don't want to do it. So you see that they're really sad and all of that. So this could be a warning sign to see specialists in that area who can also help the person, you know, to cope with that stress of dealing with this chronic medical condition, because it's the chronicity of it that it actually, you know, increases the risk of the mental health situation. Okay, and those who do not already have a clearly defined diagnosis of mental illness, you could start on time, improving your lifestyle. Okay, eat right, to have time for physical exercise, do checks, you know, from time to time, check your blood sugar levels. Okay, because if it's detected on time, then, you know, it could just be dietary modifications that may be required, okay? And then some lifestyle changes to stabilize things, okay? But if it's established, make sure you use a medication, you know, see your doctor's appointment, do the necessary testing, okay? Because sometimes the complications of the diabetes mellitus itself could also be what is causing the mental health issues, okay? So complications like sudden dip in the level of blood glucose, that is the hypoglycemia, ketoacidosis. So they could present with delirium. They're just talking irrelevantly. They are confused, they're disoriented, all right? They don't know
Is that what you call delirium or something
delirium,
like that?
yes.
Okay, all right.
So they don't know the right time of the day, or they're not sure where they are. So there is a confusional state at that time. So usually by the time the complications start setting in, you could have more of that. So try to prevent the complications, you know, by complying with the use of medication.
We have to go now, Dr. Egegbar. However, we like for people, I feel it's something that we can prevent. I hear that diabetes is something that is hereditary in some cases, whereas some people can develop due to their lifestyle. What would be your words to those who are not, you know, let me say by genes connected to diabetes? We want to talk to people about their lifestyles and how people can also take care of themselves once diagnosed with diabetes or mental disorders, or both of them, you know, in connection to each other.
Okay, even if there's a genetic predisposition, it doesn't automatically mean that an individual must develop the disorder, especially if your lifestyle is right, okay? So reduce the excessive intake of sugary things, okay? Do regular physical exercises, reduce the amount of stress, okay? Because a lot of stress beyond what an individual can cope with can cause development of mental illness or development of other physical problems like diabetes mellitus. Talk to somebody when you're stressed, because even having disorder like depression can open the door to other illnesses like diabetes mellitus.
Yeah,
All right.
absolutely. Thank you very much. And everyone now and again go to the pharmacist or the chemist and do a blood sugar test. You get a glucometer, which is what will test your blood sugar. Once you see the reading, it tells you exactly what it is. You go check up and find out whether you're borderline or you're already in it. The earlier you know, the better you start to work on it. Thank you very much, Dr. Ihunaya Egegbar, consultant psychiatrist. It's a pleasure having you with us.
Thank you.
All right. So we'll take a quick break. When we come back, we'll come talk about something very important. Please stay with us. We'll be right back.